Good afternoon. Welcome to the Sunday Daily Update at the EMA office, where I'm joined with the Chairman Mark Kern, and Barb Holt, the Director of the St. Clair County Health Department, is joining us via the stream today. Barb, welcome.
Thank you. Yes, and
Good.
we have the updates for today of day 233. Today we have 87 new positive cases in St. Clair County of COVID to report. Those are both males and females under 10 years of age up to 70 years of age. That makes our daily county positivity rate just for today of 9.6%. and our 7-day rolling average of 8.5%. So the totals for St. Clair County, we had an increase of 903 tests conducted, makes it a total of 117,672 tested, and of those, 9,431 tested positive, and 108,241 were negative. We're very sad to report we have another death to report today. It was a female in her 80s with unknown health conditions. This brings the total deaths in St. Clair County to COVID-related illness to 224. And again, we extend our sympathy to this individual as well as the rest that have died due to this COVID. Statewide, we had a high date today of 6,980 positive cases for a total of 280 positive cases, with 7,808,303 tested. And the state is also reporting an increase of 35 deaths statewide for a total in Illinois of 9,792 deaths. Hospitalization rates, again, these are current for St. Clair County hospitals. For St. Clair County, we have, in our hospitals, we have 69 COVID-19 related patients, and of those, 6 are on ventilators. Then in our regional hospitals, we have a total of 120 patients, and 13 of those are on ventilators. For the congregate care and long-term care facilities, we have 2 new cases to add at the Marquay Nursing and Rehab Center. This is their first 2 cases, and they have no deaths at this site. Again, today I was at the Bevel East drive-through testing site. We had a great turnout. They're still there till 4 o'clock today. This week we'll also be at Millstadt at the park. That's a drive up. That will be on Wednesday from 10 to 12 and also from 1 to 3. And then we have others that we're working on to get set up, as well as every day that are available at the JJK Center in East St. Louis and several other places, including Walgreens, CVS, MedExpress. But we do recommend that folks call first just to make sure you can get an appointment or get in line, ensure they have enough reagent to do your testing. So more testing sites to follow. And with that, I will turn it over to Chairman Kern, sir.
Thank you, Barb. The hospitalizations are way up, more than we've seen for a long time. Barb, don't you think that's something that we really need to be aware of and be concerned about?
Absolutely. And again, as we look at that, that's what we've been concerned all along, to ensure not only for COVID patients, but it is flu season and just our normal need for a hospital. We need to ensure that the hospital has the capacity to be able to take care of very ill people.
I'll have to look back, but I don't know that we've been at 69 since in the middle of the summer, or maybe even back in April or May. Certainly a large number.
I agree, in the hundreds for the regional rate as well. So they're both high, both locally for St. Clair County and in our region. I concur.
Thanks, Barb. Well, we'll move into the zip code report now. And since we didn't get any reports yesterday from the state, this will be 2 days of zip codes added together. So you'll hear some higher numbers today. In 62201, up 4 to 296. 62203, up 3 to 291. 62205, up 3 to 252. 62206 up 4 to 547. 62207 up 4 to 285. 62208 up 10 today to 552. 62220 up 4 to 699. 62221 up 16 to 866. 62223 up 5 to 580. 62225 up 1 to 41. 62226 up 28 today to 1,007. So that's the first time we've broken the 1,000 mark in a zip code. Today, 62226 at 1,007. 62232 up 3 to 254. 62239 up 2 to 142. 62240 up 1 to 48. 62243 up 7 to 147. 62254 up 5 to 308. 62257 up 2 to 61. 62258 up 15 to 266. 62260 up 9 to 185. 62269 up 12 to 753. 62282 up 1 to 19. And 62285 up 5 to 161. Our daily county positivity, as Barb mentioned, 9.6% today. That's derived by an increase of 903 tests with 87 positives. That brings our 7-day rolling average now well above 8 to 8.5%. That number needs to be below 6.5%. And at one point, we were well in the 5 range, and we had some days of county positivity in the 4% range. So we have been moving in the wrong direction. We need to get back to that point. The state has us pegged today for regional positivity at 9.1%. That number is derived by the fact that Bond County comes in at 11.1%. Clinton County is at 11.7% today. Madison County at 10.2%. Monroe County, again, 20.5%. They top out the chart at 20.5%. Randolph County helping out today at 5.5%. St. Clair County at 7.3%. And Washington County at 23.3%. And if we look at the age ranges today, total cases under 40 years old, we have 45 people today under 45 that were COVID positive. Herb?
Well, Chairman, and as we've been watching all week, those age limits are getting younger and younger each and every day. So that's definitely an alarming metric that we're watching. And as you and Barb talked about, the hospitalization is another metric that we can be measured on. And when you're talking 120 patients throughout the region, that is a high that we'll go back and find out when the last it was that high, and then 69 here in just the county alone. But that 9.1 regional positivity rate is the alarming button that we should all be alarmed about. It's definitely going in the wrong direction. And again, the outer counties, some of them are trying to do better. Some of them need to do better. So it's teamwork, as we say all along. We got to pull together, and we if we can do that, we'll be doing it. Today is the question and answer Sunday that we do. Brian, you said there were some questions that come in. We have them.
Yes, sir. I'll start with Barb with the health department questions that came in. Barb, the first person wrote, with the rising numbers in our county and surrounding areas, is it a good idea for schools to be reopening with students, or is remote still the safer option?
Again, the schools, and we've learned a lot about this virus since the beginning of the year. Both IDPH and CDC, Illinois State Board of Education, we've all put our heads together and written guidance for schools to operate either remotely or hybrid, or how they can have in-person schooling. And again, we know the best methods we have right now, the tools in the toolbox, are to wear your mask, properly wash your hands, and do your social distancing. Schools have several options. We know the best way for students to learn is in person, especially for those younger students. The schools are working diligently with all different types of options to offer to the parents for their students. And if they feel that they can meet those guidelines the best they can for in-person, again, for remote or for hybrid, and the schools are very diligent and doing a very good job of offering those options to parents for their students.
Okay, thank you.
And Barb, I think we want to mention also that the schools are in constant contact with your office if there is any questions. I think sometimes that gets unforgotten, that the health department is there to help those schools all along.
Absolutely. We're in 24/7 contact 7 days a week with the superintendents, the school nurses, the principals. And again, we have a very good working relationship with them, and they have several of their own staff that have gone above and beyond and have taken the contact tracing courses on their own to be able to better understand how the disease is spread and how we need to isolate and quarantine. So they've been very helpful throughout this whole process.
Okay, thank you very much. The next person wrote, what concern is there regarding younger ages of people catching the virus?
Again, just as young, old, 40 to 49 years of age, or up to 80, 90 years of age. Again, a lot depends on your own individual health. Younger individuals may have other immunocompromised situations, or they may have asthma. Again, it seems to affect those that already have some type of health illness to begin with. So with the children, be they be 2 years and up, as the mask mandate says, 2 years and up, they must wear masks, on up to whatever age it is. We encourage that hand washing. This is a respiratory illness, so proper hygiene, wearing the mask, covering coughs, covering your face, washing your hands, and doing that social distance, regardless if you're a younger age, 20, 30, 40, or up to 90 years of age. That's what we recommend to everyone.
Okay. The next one says, for hospitalized patients in St. Clair County hospitals, does the total reported daily include all patients related to COVID in the St. Clair County hospitals or just St. Clair County residents?
That total are patients that are in St. Clair County hospitals. Yes, they can be from out of the county. So those are patients that they are serving. Again, this is a regional hospital. Our hospitals open their doors to other folks in the surrounding counties. So we report our daily report of St. Clair County hospitals. As we said today, 69 patients. That can be patients from out of St. Clair County as well.
Thank you for that. The next one, also on the hospital topic, says many hospitals are merging regular illness and COVID positive patients on the same floor. Is this advised, or is it up to the hospital or any way to regulate this?
Again, yes, this is up to the hospital, and the hospitals deal with infectious disease every day, not just COVID, but there are all different types of communicable infectious disease that they deal with. They are properly trained. Some hospitals, depending on their situation, may have a wing set up or certain floors or certain levels. Again, it is up to the hospital how they set up their facility in dealing not only with COVID patients, but other illnesses that may be a communicable disease.
Okay. Next one, kind of a follow-up to the earlier conversation you had about schools. This person wants to know, is it safe to reopen schools when you cannot keep the students 6 feet apart?
Again, each of the schools is required to have their plan in place and ensure that they're following Department of Public Health and CDC guidelines with the masking, with 6 foot social distancing, ensuring the best they can whenever possible to follow those rules. That's why they're also offering options for the parents of not only in-person, but remote and hybrid training as well. So they have several plans in place and are working very hard to maintain all those guidance information to ensure that they're protecting their students as much as possible.
Okay. The next person writes, what punishment or punishments are there for restaurants and bars that choose to ignore the mitigation policies?
Again, they were defying the governor's mitigation orders. It's the folks that are visiting them as well as the services they are offering. They are possibly taking a chance on their own liability insurance, as well as furthering the spread of disease to other individuals. Again, there's a lot of information out there for how to protect themselves, offering curbside service. This is the best what we know at this time to keep people 6 foot apart, to keep people social distance, to make sure they wear their mask. And facilities, we are following up with all complaints that the health department gets about facilities that are not following the governor's mitigations. We're calling them to remind them to ensure they understand these are the rules. And we're also referring those complaints to their local law enforcement and the liquor license commissioner in that particular area to let them know that we're receiving complaints, to make sure to try to encourage these people to follow the governor's mitigation guidance and help protect public health.
Okay. The next one says, according to the governor's mandates, a vaccine needs to be available to open the state. I can't find any guidance on how many people have to have the vaccine before that happens. Is there any set number that you're aware of?
At this time, we're not. And yes, that is part of the governor's phase 5 guidance documents, that vaccines need to be available. And again, we need to realize this will be a new vaccine. This is a new virus that we're dealing with. So more information as we go along will help identify those answers, and we'll have the best answers that we know at that time.
Okay. The next person writes, 9,000 plus positives for St. Clair County. Is that total positives year to date, or is that for a daily amount? Additionally, they ask, is a person only considered positive with a positive test? We know that there can be false negatives if a person is tested too soon.
The 9,000 plus positive cases we report on a daily basis is those that have tested in St. Clair County that day. So each day we take all the test reports we receive from the labs, and we count all the tests conducted, and of those, we count all the positive cases as well. Those are a cumulative number from the first days in February and March when the testing was started and available in the United States and Illinois. So it's a cumulative total of all those that have tested. That can include folks that have tested once, twice, 3 times, if they tested positive on 3 different occasions. So that is a cumulative total. If we do 1,000 tests this week and we have 200 that are positive, we count those 200 positive towards that 9,000.
Okay. And this person had a secondary question related to the deaths. It says, for the deaths in our county, is a death only counted if the death certificate states COVID, or are there other causes of death that could be added to the total? And how do you determine where that cause of death is determined?
The cause of death, we report those as being deaths reported to us by the facility when what the death certificate states. There is a definition, and I can provide that too if you would like, the definition that if within the last 30 days the individual did have COVID, they may have other comorbidities that were part of the death certificate of why the person passed away. But if COVID is part of that, that is considered part of the reason for death. Again, those are conducted by the medical advisor, and what is specifically written on the death certificate, that is reported to us. We do not review those. That is reported to us.
Okay. The next person says, when an individual gets infected with COVID, what is the time frame that they could be spreading it to other people?
Again, as per CDC guidelines, if someone is infected with COVID, let's say they're asymptomatic, they have no symptoms, they are isolated for 10 days from the date of the test. If an individual has symptoms, let's say they start feeling ill and having headaches or runny nose on Sunday, and they go get tested and find out they're positive on Tuesday, the CDC guidance and IDPH guidance is you go back 48 hours from when the symptoms started, and then you count your 10 days. So it's 10 days for isolation, and once you've completed those 10 days of isolation, then it is said that you have somewhat of an immunity that you don't have to be quarantined if you're exposed to anyone else that may be positive for about 3 months. If an individual is in contact with someone that has tested positive and they've been near that person in the last 48 hours of when either they started becoming symptomatic or they had their test to prove that they were symptomatic, they are quarantined for 14 days. And again, either scenario, either isolation or quarantine, as long as they have no more symptoms and their symptoms are at least they're all better, that they are they're fine. That is part of the CDC and IDPH guidance, that they are not communicable to anyone after that as far as their symptoms have subsided. We know there are several cases where folks have said that they may have lost their taste and smell for a while. Even after that, they feel fine, but they still can't taste or smell for a while. So it's 10 days for a positive and 14 days for a contact for the isolation and quarantine rules.
Okay, and one last one that came in says, if positivity in cases are worse than they were in March and April and August and September, why are schools choosing to remain open? Thank you for your dedication and hard work every day.
Well, thank you. And again, as I stated earlier, we know a lot more about the virus now and what we can do to control it. Again, the 3 W's with wear your mask, watch your distance, and wash your hands. And in the guidance that the State Health Department, CDC, and State Board of Education have provided to have schools open if they can follow those guidelines. And again, yes, school is very important. Essential services are very important, and schools are doing their best to protect the students from spreading this disease within the school. Again, with the option for parents, they have the option of remote or hybrid, whatever the case may be. But every day we're learning more and more about this disease, and the schools feel through many, many plans that they have that they can provide the best and safest learning facility for their students.
Okay, thank you very much. Chairman Kern, we've got a couple that have come in here for you. The first one says, do you know what mitigation measures will take place if the rate continues?
So we have experience to know that because Region 1 in the state of Illinois is currently under a Tier 2 mitigation right now. And basically what the state says under that Tier 2, that they need to limit the gathering sizes. So then they take the crowds that you can be a part of, or the gatherings that you can be a part of, they take that number down to 10 and tell you to just stick with the 10 or less people. And if you're outdoor dining or at an outdoor establishment, liquor establishment, that needs to be 6 or less at your table. So those numbers are basically reduced also. So it really is just limiting the size of the parties that you're with to try to get a hold of the spread of COVID in that particular region. So we're not there yet. Hopefully we don't get there, but that's what is in the future if we don't get our numbers in check.
Okay. The next person says, why is St. Clair County not demanding contact tracing data? The state continues to blame numbers on restaurants and bars, but hasn't provided any data. St. Clair County should be demanding that transparency.
So I agree that I think contact tracing data telling us where people are contracting this, to the extent that they're going to tell us, to the extent that they're going to be forthright where they picked up the virus, or even to the extent that they know where they picked it up. I think it's important to know that, so we'll continue to request that data, and when we get it, as soon as we get it, we put it out that day to let you know the data. So I agree that it's important to know the contact tracing data, and we'll continue to work to get that information to you.
Okay. The next person says, why do you and the governor keep using a bogus indicator like positivity rate instead of hospitalizations? The number of people testing is not a valid number. Only people who are sick, been around someone who might be, or need to be retested are those getting tested. More than 50% of our county has not been tested.
So I think, first of all, testing 50% of the county, 117,672 people tested, is really a pretty monumental feat. The problem with using the hospitalization number is that it is, once you reach the level where you know you're in trouble, where you got too many people in the hospital, it's too late to do anything. From experience, it shows whenever mitigations are put in place, it takes a while. In some cases, it takes a month to get back to the number that you want to be at. So because we track, we're on day 233, the positivity rate really is a leading indicator that helps us to analyze when we think hospitalizations are going to go up. So by using the positivity rate, we get a little bit of time that signals, hey, you better look out, because hospitalizations will follow if your positivity rate continues to go up. So the reason it isn't it's not a perfect measure, but it's the best measure that we could come up with. If there was something else to use that would signal to us when hospitals were going to be at a critical level and give us time to be able to mitigate that, we would certainly be using that. But for now, this seems to be the standard all over the country, and that's the standard that we use here.
Okay. And the next person says, what information or science is being used to decide that infection rate is increased due to bars and restaurants? I think other areas should be checked, such as retail stores, gambling, voting lines, and driver's facilities. Has IDPH considered reviewing the science they're using in these other areas?
And so it really goes back to the question of the contact tracing. I don't disagree. I think there are places that where you can contract COVID that perhaps aren't being mitigated. I assume IDPH is taking all that into account when they create their mitigations. And so if a place becomes a problem, if they see that any of those types of establishments are causing the issues, I'm certain that they'll be added to the mitigations in the future.
Okay. Thank you, Chairman. Director Simmons, one question that was asked, we talked a little bit about this earlier, says what metric will be the all clear for no longer needing masks?
Well, I think Barb touched on that, but, from everything that we keep up on our region, there's going to have to be that vaccine that we're all waiting patiently for, or there's got to be some type of highly effective treatment out there, as it states in phase 5. So we've all got our fingers crossed that, that gets here real quick.
Okay. And a comment that came in says, with Thanksgiving, Hanukkah, Christmas, and New Year's coming, sadly, we're going to be here longer. And with so many restaurants opened against the restrictions, it feels like it will be much longer before we see normal.
Yes, and we appreciate all those comments that come in. There was a couple of messages that came in last night about why do we continue to do these briefings. And I think the reason we do it is pretty clear, keeping those who want to be informed up to date that we've done for 233 days now. Team St. Clair has been very supportive of that. One note, if we could get our neighboring counties to be doing the same thing we've been doing for 233 days, I got to believe that would definitely be a way to get these numbers down. So, again, we just ask that the counties around us continue to do the best you can, and that's what we're going to continue to do here. We're going to continue to report these daily briefings to you because Team St. Clair has demanded it, basically.
Knowledge is power. And as we said from the very start, we wanted to make sure that you got the most accurate information presented to you on a daily basis, so you had a place, Team St. Clair County residents had a place to go to find the numbers on a day-to-day basis to know what that rate is and the rate of infection in our county. And I think for 233 days, no matter what can be said, I think people at least know that they have a place to tune in and get the numbers as they're being reported by the Illinois Department of Public Health, as they're being reported by the St. Clair County Health Department, thanks to Barb Holt's leadership. All these numbers are presented to you in a concise form every day, so that on less verbose days, in 15 minutes, you can pretty well get your briefing and find out what's going on and get on with the rest of your day.
Well, and, we want to thank everybody, Tammy, our lady who does our signing for us, Daisy and Cindy, that comes in and translates it into Spanish communities. It's a teamwork, and that's why Team St. Clair has been so important. So we're going to be here. We'll be back in just a few moments with Daisy to translate this into our Spanish communities, and then we'll be back tomorrow with some more news and information for you. Thank you.
Mask, gloves, soap, scrubs, TikTok, Grub, Hub, Twinks, Jocks, Bears, Cubs, Zoom is the new club. 6 feet, no hugs, still beat these mugs. Mask, gloves, soap, scrubs, mask, gloves, soap, scrubs, mask, gloves, soap, scrubs.
Mask, gloves, soap, scrubs, mask, gloves, soap, scrubs, mask, gloves, soap, scrubs, mask, gloves, soap, scrubs.
No school, gym closed, don't touch these clothes. Need food, this blows. Line at Trader Joe's. At home, gym, fish, don't come close. Just wave, wave, blow a kiss. Mask for mask, sis. Left, right, swiping on Tinder. What was life like? I can't remember. Needing my haircut, somebody shave her. Where is all of the toilet paper?
Gloves, soap, scrubs, mask, gloves, soap, scrubs.
Okay, dolls, y'all know what time it is. Come on, stay inside and lock the door. Stay inside and
Buenas tardes y gracias por acompañarnos una tarde más. Barb Holt, la directora del Departamento de Salud, estuvo con nosotros hoy vía llamada telefónica anunciando los números del condado y del estado. Estamos a 117,672 exámenes que se han conducido y ese es un incremento de 903 exámenes conducidos del día de ayer y 9,431 exámenes positivos, que incluye 87 nuevos casos de hombres y mujeres en las edades de menos de 10 años a 70 años. 108,241 exámenes negativos, 224 muertes, y esto incluye tristemente una nueva muerte de una mujer de 80 años que no tenía problemas de salud previos. 8,472 es el número de personas que obtuvieron un resultado positivo y que han completado los 10 días de aislamiento requeridos por el Departamento de Salud. En el condado hay 69 pacientes hospitalizados por problemas relacionados con COVID y 6 de ellos están en ventiladores. En la región hay 120 hospitalizados y 13 de ellos están en ventiladores. Hoy solo se reporta un cambio en el número de casos en las instalaciones de cuidado a largo plazo, que es en Marca Nursing and Rehab, con 2 casos. Y los números estatales son de 7,808,303 exámenes que se han conducido, 417,280 casos positivos, y esto incluye un incremento de 6,980 nuevos casos en el estado y 9,792 muertes, que tristemente incluye 35 nuevas muertes en el estado. Estamos a 9,6% de casos positivos en el condado y en la región estamos a 9,1%. Mark Kern, el director del condado, estuvo con nosotros hoy anunciando el número de casos por código postal, y esto incluye los números de ayer y de ahora. En 62201 hay 296, en 62203 hay 291, en 62205 hay 252, en 62206 hay 547, en 62207 hay 285, en 62208 hay 552, en 62220 hay 699, en 62221 hay 866, en 62223 hay 580, en 62225 hay 41, en 62226 hay 1007, en 62232 hay 254, en 62239 hay 142, en 62240 hay 48, en 62243 hay 147, en 62254 hay 308, en 62257 hay 61, en 62258 hay 266, en 62260 hay 185, en 62269 hay 753, en 62282 hay 19, en 62285 hay 161. Y hoy tuvimos la sección de preguntas y respuestas, y hoy solo les voy a mencionar 2 de las preguntas que se hicieron. La primera fue: ya que los números van aumentando en el condado, ¿es buena idea que los niños regresen a la escuela? Y la respuesta fue que las escuelas han tomado todas las medidas adecuadas, como implementar que los niños usen el cubrebocas durante todo el tiempo que están en la escuela y asegurarse de que estén guardando el distanciamiento social. Es muy importante que los niños regresen a la escuela, especialmente para los pequeños, ya que su educación depende mucho de eso. La segunda fue que ¿qué castigos hay para los restaurantes y barras que deciden ignorar las pautas del gobernador? Y la respuesta fue que el Departamento de Salud se asegura de llamar a esos negocios y recordarles de las pautas. Cada queja que llega al Departamento de Salud se la dirigen a las autoridades del municipio del negocio y a la Comisión de Licor para que ellos investiguen. Y finalmente, Herb Simmons nos recomienda que sigamos usando el cubrebocas. Gracias.